go.
What's up, guys? Today I'm going to teach you guys about inflammatory bowel disease or IBD. Do you guys know anything about IBD? Do you guys know anyone who has it? You?
I mean, I have a friend that has it, but I don't know anything about it.
Oh, you don't know anything about it?
He says it hurts.
It hurts. Does anyone else know anything about it? Nope. Okay, so I'm going to start off with the introduction. Inflammatory bowel disease is an autoimmune disease, and it's not AIDS. A lot of people think that it's AIDS because it's AID, but AIDS is acquired immune deficiency syndrome. But an autoimmune disease when your body develops it. Your body thinks, your immune system thinks that your healthy cells are foreign, so they attack it, and that's what causes IBD. Well, there's different forms of autoimmune disease, but this is what the specifics. There's no cause and no cure, but researchers believe that it is linked to genes, mutations in genes. There are only treatments to suppress the symptoms, but no one knows how to stop it. There will be times where it'll flare up again, and this disease is pretty much permanent. This disease, IBD, it is mild to severe swelling ulcers in the gastrointestinal tract, which is anywhere from your mouth to your colon. And yeah, symptoms are they're pretty bad. Like he said, it hurts. You sit there, it's like cramping. You get fatigue, fever, diarrhea. Your GI tract can start bleeding, and then it's just all bad. And in the really severe cases, for children, it can stunt your growth and delay or stop your sexual maturation. There are a lot of ways to diagnose this disease, and first start with blood tests. The doctors could take your blood and bring it to the lab and test it for anemia or infection. Anemia is it's like a condition where there are not enough red blood cells to carry oxygen to tissues, and if you test positive for that, doctors can better diagnose what you have, or they could test for the blood. Like I said earlier, the GI tract will start bleeding with the swelling and the ulcers, and they can test for the blood in your fecal matter or poop. These procedures are much more painful. They call it endoscopic procedures, and this is where there's a small tube with a camera attached to it, and the doctor will go in with the tube, and a colonoscopy would be viewing the colon. If you guys know what the colon is, it's the last part of your anus, and the doctor will go through there and see if there's any swelling or ulcers, and they could even take tissue samples. Yeah, they can do this. They either can go through your rear end, or they can go through your mouth and then go to your stomachs and see. Or the easiest way, but not many doctors, for some reason. I don't know. I think it's a money issue, but patients could also take a pill with a camera in it, and they'll take pictures of the GI tract, but the option is usually not available. The imaging procedures, these are procedures they're for the more severe cases. You can get an x-ray or a CAT scan, and it'll show the details of the inside without the doctors actually having to go inside. But like I said, this for more severe cases, for ruptures in the colon and stuff. To treat inflammatory bowel disease, the doctors generally start with milder drugs first. So they'll start from the bottom up. So they'll give you like they'll give you these basic drugs, and if they don't work, then they'll up the levels. And they often give you anti-inflammatory drugs to stop the inflammation in your colon and stop the bleeding. And if you have any infections, they'll give you antibiotics. If none of these options work, you're gonna have to go. The patient will have to go through surgery, and then the doctor will try to stop swelling and ulcers. Life with inflammatory bowel disease is pretty difficult. Like I said before, it's a permanent disease. Then once you suppress the symptoms, they'll still come up again. So, like after you, I guess, treat it, like months later, you could be out with friends, and then all of a sudden you'll get cramps, start bleeding, and people with IBD will have to adjust to that. They'll have to bring their own stuff and always be prepared for things like that. It's tough, but it's possible. And yeah, any questions? Yeah, go ahead.
How do you know you have it again?
I'll show you guys the symptoms again. These are symptoms. It'll be like you think it's pretty related to stomach flu, like the symptoms. Like you'll get cramping, you have fatigue and fever. But you'll know when you see like the blood in your stool.
You guys said it was like, you guys said it wasn't AIDS, so like, is it like AIDS?
No, I mean, AIDS is acquired immune deficiency, so you get it from someone else through like bodily fluids, transfer bodily fluids. But an autoimmune disease, it's your body develops it, like you're like born with it.
Those are like the same systems? Yeah.
Yeah, they're pretty much the same thing happens. Like your body attacks itself. The GI tract is the gastrointestinal tract. It's it's from your mouth all the way to your colon, like you know, that's your esophagus or stomach, your intestines. Yeah. What happens when you have IBD? What happens to your gastrointestinal? Oh, what is? I mean, what, you have anything?
You get ulcers?
Yeah, ulcers in your GI tract, swelling. What are the causes and treatments?
It might be past that gene.
It's in your genetics. What are the causes? Do you guys remember any of the treatments?
Antibiotics?
You have to go through drug therapy, plastic surgery.